Before I started this program, I wasn't entirely sure what public health really was. I knew that for me it was about looking at the big picture, about believing that the public should be healthy, but I didn't really know what that would look like or how to make that happen. The people around me didn't really seem to know quite what it was either, as evidenced by those graduation cards I got congratulating me for finishing nursing school or becoming a social worker. When people asked me to explain my choice of graduate studies, my response was usually either to launch into some long-winded explanation, or when I was trying to keep it simple, I usually said something like, public health is everything. Here's what I mean. I knew that public health was about more than disease control or swine flu. All right, at the time it was avian bird flu, but you know what I mean. Some people think that public health is just about getting people to eat right, stop smoking, and get vaccinations. But beyond physical disease prevention, public health is about well-being, which includes mental health and access to good housing, education, green spaces, and safe, dignified work. I was drawn to public health because I saw an emerging practice that looks beyond changing individual behaviors to address what makes people sick in the first place. And we don't have to look very far to understand what it is that makes people sick. How is it that in the Bayview District in San Francisco, a predominantly African-American community, has one of the highest homeownership rates in the city, but one of the lowest overall income levels? Infant mortality rates are twice as high in the Bayview as compared with the rest of the city. And women there have some of the highest breast cancer rates in the entire country. This is not some far-off land. This is right here in our city. And these problems extend beyond San Francisco. I learned yesterday that Black children in New York City are 32 times more likely than white children to be incarcerated. It is clear that well-being, resources, wealth, and even freedom are not equally distributed, and that individual behavior change alone cannot solve the broader social problems that we face. Angela Davis said, "Radical simply means grasping at the roots." I would venture to say that public health, as we wish to practice it, is a radical act. It is about identifying the underlying factors, including poverty, racism, and trans and homophobia, that perpetuate health and social problems. In doing so, we locate our responsibility and our capacity to do that work that can transform the world. Improvements in the health of our society haven't come about by medicine or science alone. We know that we can't stop the spread of disease without addressing the devastating impacts of contaminated water and water privatization on poor communities. We see that incarcerating over 2 million people without investing in education, jobs, and community infrastructure will not make our society safe. And we understand that we can't find the solutions we seek in isolation, that we need to work together, drawing upon our differences as strengths rather than limitations. On the first day of this program, as I sat in a circle and learned about my classmates, I realized that each of us is inspired by a different component of public health. I listened to my classmates share about their backgrounds and interests in healthcare, education, food safety, youth empowerment, queer and transgender organizing, and more. And I knew that I was going to learn a lot in this program. As a group, we are many things. We are artists and poets, activists and epidemiologists. We are dancers and singers, parents and yoga practitioners. We are future doctors and dentists. For us, public health is about bringing art and theater into the classroom as tools to empower. It's about widening the lens of the medical system to both provide quality individual care and increase who has access to that care. It's about bridging health and spirituality through yoga, dance, and meditation. From here, some of us will work as nurses, community organizers, and program directors. We will be in nonprofits, schools, and health departments. We will conduct research in partnership with the communities that research hopes to benefit, and create programs that build off the strengths of those communities as well as their needs. We will be fighting to change the landscape of healthcare altogether so that there will no longer be close to 50 million uninsured people in this country. Wherever we are, we will be working to change the conditions that cause health problems in the first place. Thank you to everyone who makes this program possible, and to our friends and families for all of your support. It has truly been an honor and a privilege to learn and grow with my fellow classmates, those who are graduating today and those who will continue on into the next year. I thank you all for changing my life, and I am so genuinely excited to see where we go from here. I believe that we will do great things, and that the world will be a little better for the passion, commitment, enthusiasm, and tremendous heart that each of you bring.